Introducing the OsteoCool RF ablation system from Medtronic for the clinical treatment of bone tumors. Bone is the third most common location for primary cancers to metastasize, and the majority of those bone metastases are located in the spine, 69%, pelvis, 41%, and hip and femur, 25%. Occurring most frequently among patients with primary malignancies of the breast, prostate, liver, and lung, metastatic bone disease has been reported to occur in 60 to 80% of cancer patients, and in 79% of patients with skeletal metastases. The most frequent complaint is pain associated with the disease, a pain that is usually progressive and significantly reduces quality of life. When conventional therapies are considered ineffective, too slow-acting, or cause unacceptable side effects, ablation provides a treatment option for these patients without disrupting existing cancer treatments. The OsteoCool RF ablation probes use a coaxial bipolar technology that delivers localized tumor ablation based on algorithms designed to perform optimally in bone. The probes are internally cooled. RF energy heats the tissue while circulating water moderates the temperature in close proximity to the active tip. This combination creates large volume lesions without excessive heating at the active tip. During the OsteoCool procedure, the OsteoMap technique will help determine the proximal and distal ablation zone boundaries. Using image guidance, the osteo-introducer is advanced into bone. The distal tip of the stylet is intended to provide visual indication of the posterior boundary of the ablation zone. For bipedicular ablations, repeat this step on the contralateral side. For tumors located outside of the spine, such as in the pelvis, a parallel approach will provide variances in ablation zone size and shape. Remove the stylet once desired depth is achieved, and advance the precision drill down the cannula. Read the color marking on the proximal shaft of the drill to aid in probe selection. Each color represents a different probe size. Select the probe size that corresponds with the color marking at the desired insertion depth. The distal tip of the drill is intended to provide a visual indication of the anterior boundary of the ablation zone. For additional temperature monitoring, an independent thermocouple can be placed through a separate incision site near the area to be monitored. The OsteoCool generator screen indicates when a probe has been connected to the connector hub and when it is ready for use. Ablation time is preset based on the active tip size of the probe being used. Place the OsteoCool probes through the bone access cannulas, ensuring they are fully seated. Turn on the RF power button. The generator will track temperature and power output over the duration of the procedure. Allow the generator to complete the ablation, monitoring intermittently for any signs of error on the generator screen. An option to perform track ablation is possible with the system. Select Retract and initiate ablation. Slowly pull back on the RF ablation probe and bone access cannula simultaneously. Repeat on the contralateral side if desired. If required, bone access can be used for a subsequent physician-directed procedure such as cementoplasty. The OsteoCool RF ablation system, only from Medtronic.